right, it's not a public holiday. These days are set aside to create awareness about some serious medical conditions. And the part you have to play is talk about these things, create the right kind of awareness, and of course, get involved, make your contributions, encourage someone living with these conditions. And we have a doctor on the line with us who's going to be giving us insight on diabetes, the causes, the symptoms, solutions. And of course, if you have questions for him, you can call in on the program. So, like I said, the World Diabetes Day is observed annually, that's yearly, every November 14. All right, we can raise awareness by promoting education while you're at work, at school, whatever it is you're doing at home. So, and support those living with the condition. All right, so Dr. Samuel Omobade, a general medical practitioner, is on the line with us this morning, and he will take over shortly. All right, Dr. Samuel, good morning to you. Hello, good morning to you.
Good morning.
All right, good to have you
Morning.
join
It's
us.
good to be here with you.
All
I'm
right,
super
then.
happy.
All right, well, happy to have you. So now, let's start with how is the morning going for you, by the way? How do you feel about creating awareness about diabetes? Hello, can you hear me?
Again.
Okay, I said, how is the morning going for you?
Yeah, my morning is fine. Very well.
All right, that's
I'm
good.
already at work.
Oh, you're already at
Yeah.
work. Oh.
Yeah.
All right then. So we'll just take some of your time. Okay, now, so let's start. What is diabetes? Is it? I called it a disease. Is it a disease, or condition? I don't know the difference. But what is
So your
diabetes?
voice is going low.
Okay, so I said, what is diabetes? Is it a disease or a condition? Because I called it a disease, but you can just expatiate. I don't know what the difference is here.
Oh, okay. Generally, disease are conditions. They are the same thing, really.
Oh, okay.
Diabetes is it's a like I said, they're the same thing. Whether I call it disease or condition, but um, it's it's more relatable when you call it a condition. So it's a medical condition where um, the body is unable to utilize glucose that is available. So it's a metabolic disorder as well. So when we say metabolic disorder, it means that certain basic units of food that we take in is not being used up by the body, or it's in excess, or it's in deficient. So in this case, it's glucose. So the body takes in, when we take in foods, the body extracts the glucose from our food, taking it into our bloodstream so that organs can use it, different organs. And these organs are going to use it based on insulin. If there's insulin available, insulin is going to drive glucose into your brain, drive glucose into the heart, drive glucose into the different organs of the body so that the body, those organs can begin to use it. If there is no insulin, which is the case in some type of diabetes, or if there is insulin but the body cannot respond to insulin, that these organs I mentioned don't respond to the available insulin, the glucose that is available is not being used. It's not taken into organs, so it just remains in the blood. So you are going to, the patient is going to have high glucose level in the blood. So basically, that's what diabetes is, if I'm going to explain it
Okay.
to the
So,
general.
yeah. So, what does glucose do for the body, one, and what is insulin?
Okay.
Yes. Can you hear me? I said, what does glucose do for the body, and what is insulin? You talked about those two. Hello, doctor.
Yes, there is a system here.
Can you hear me?
Yes, I can hear you now.
Okay, I said, what does glucose do for the body, and what is insulin? You talked about those two.
Oh,
So
okay.
what? Yeah.
I'll start with what insulin is when I come to glucose.
Okay, that's fine.
Insulin is a hormone that is produced by the pancreas. The pancreas is one of the organs in the body. Insulin is produced by a part of this hormone, and it's necessary for the metabolism of glucose. That is, when glucose comes into the bloodstream, insulin is necessary for the use of glucose. Like I explained, how glucose is used in the body, insulin is necessary for it. Now, what glucose does, glucose is what provides energy. Um, it, it goes through different metabolism or different breakdown in the organs, and then it releases ATP. That's ATP is the unit of energy, for those of us that did a little bit of science. So the ATP that is being used up for the beating of the heart, for the normal processes in the lungs,
Yeah.
that's your breathing, or your kidney to be able to function, excrete um, waste products, for your brain to be able to do all the things that the brain does, for all the organs to do what they do, the muscles, all of those things, they use ATP as it were, and this ATP is gotten from glucose, or this energy for the work that all the other organs of the body does is
Mm.
gotten from, the main source of it is glucose. Yeah, so
Okay.
that's basically what glucose does in the body.
All right then. Now, are there types of diabetes? Is it just diabetes as it is, or are there types of diabetes?
There are types. There are several types of diabetes, but usually we focus on the two main types, which are the commonest, type 1 diabetes and type 2 diabetes. Type, can I go into in a little more detail?
Yeah, sure. We need all the details. Not even a little. We need the details.
All right.
Yeah.
Type 1 diabetes is a condition where, um, like I explained before, the main thing we are going to be hearing a lot in the course of our discussion is insulin and glucose. So in type 1 diabetes, what happens is that the body produces substance against um, the cells in the pancreas. The cells in the pancreas, like I mentioned before, beta cells in the pancreas, they are the ones that produce insulin. So if these cells are destroyed, insulin will not be produced. So in type 1 diabetes, that's what happens. Certain certain things go wrong with the body such that the body begins to produce what we call antibodies. Antibodies are things that attack diseases in our body. So the body sees the beta cells as not, it sees it as foreign, more like a bacteria or like a disease. That's the best way I can explain it. And then begins to produce these antibodies to attack the beta cells. Is an autoimmune problem. What we mean by autoimmune is the body is generating something against its own self.
Mm.
Um, and that's what happens in type 1 diabetes. So the body
Okay.
produces certain things against the beta cells in the pancreas. And so it starts destroying the beta cell in the pancreas such that those cells are totally destroyed and insulin is not being produced.
Okay.
So that's for type 1 diabetes. Usually we classify into type 1A, type 1B. Type 1A is what I just described. Type 1B is happening, the destruction is happening without a known cause. So call it idiopathic.
Okay.
But yeah, that's at a much deeper level. But
Okay.
we can hold it at that point. So if the beta cells are destroyed, insulin is not produced, and what's going to be happening is the glucose that is available in the body cannot be used up by the body because there's no insulin to drive in glucose from the blood to the organs. Yeah.
Okay.
All right. Then in type 2 diabetes, which is actually more common, type 1 usually occur at a younger age, relatively. It can occur later in life, but more than 90% of times it's going to happen in very young persons, as young as 7 years old
Uh oh.
child, 10
Wow.
years old child. Yeah, I've had patients as young as 9 years old
Wow. With
who were
diabetes. Wow.
diagnosed with type 1 diabetes. Usually it occurs at that younger age. But then type 2 diabetes is what we are more familiar with generally, the type that happens at an older age, usually above 40 years old. And it's
Okay.
the type that is really, really, really preventable, as it were,
Okay.
to a large extent.
Okay.
Okay, it occurs, type 2 diabetes usually occur when the body, most times occurs when the body, there's insulin available, beta cell is producing insulin, that's the pancreas is producing insulin, but the organs of the body are not responding to the insulin. So you have it present, but okay, brain, take this thing, take up the glucose, but it's not responding to the insulin that is available. The insulin is telling the kidney to take up glucose, but then it's not responding. So basically, that's what
So the
happens.
brain
It's
is
telling the liver to
disconnected.
take up glucose, it's not happening. That's
Yeah.
what happens with type 2 diabetes, such that the glucose is now so much in the blood, like you also see in type 1 diabetes, but for a different reason this
Hmm.
time around. Yeah.
Okay. So now, why would the body fight itself? Is there a reason for autoimmune issues? Why would the body just fight itself? Has that reason been unraveled already?
Um, yes. Um, I hope. Okay. Well, I'll try to break it down to the best possible way I can. So there are a lot of autoimmune conditions. That's conditions like this where the body fights itself. Type 1 diabetes is just one of them. There are actually a lot of them, and generally it's the consensus or it's observed that when it when when a baby is growing up in the womb, the body takes the immune system, that's the part of our blood that fights uh, diseases
Yeah.
or fight foreign things coming into our body. That part of the body or that part of our blood goes through all the systems to be able to recognize the organs of the body. So it goes to the heart to be able to recognize all the cells in the heart so that it will not fight it later in life. That's in utero, that's in the womb as the baby is growing up. It
Okay.
goes to all the organs of our body so as to be able to recognize it. Now, when this does not happen for whatever reason, there's really no defined or definite reason why it happens that way. But then when this fails to happen as in utero, that's in the womb, when the baby is born, that part of the body, any organ of the body that this happens with. So that's why I said there are a lot of conditions. Beta cell is just
Conditions.
one
Yeah.
type.
Yeah.
That part of the body is seen as foreign, and then the body begins to produce um, certain things to act against it because it's recognizing it as, oh, I didn't see you before.
Hmm.
Where are you here? So
It
yeah,
starts to fight.
it's that way.
All
Yeah,
right then.
that's generally on autoimmune conditions.
Yeah. Okay. Now, let's talk about the risk factors for diabetes. Now, you could focus on the one which is more common. Which is more common in Nigeria as it is? Do we have the type 2? Which is more common in your practice?
Type 2 is by far more common.
Okay.
Yeah.
So, what are the risk factors?
Okay. So risk factors for diabetes, that's type 2 diabetes now specifically. We usually classify risk factors generally into non-modifiable risk factors, that's things that you really cannot do so much about, and then modifiable risk factors, that's things that you can actually um, do something about. So for the non-modifiable risk factors, you have things like if someone has a family history of diabetes, it's likely that is at more risk, yeah, of having diabetes.
Okay.
Then so he needs to such a person needs to be checking periodically to check if he's developing diabetes or not. If those of us this from this part of the world as Africans, we are at more risk of diabetes, or it's noticed that diabetes occur more commonly with also the blacks because of our
Why?
gene. Because
Why?
of our gene.
Okay, the gene.
It's
Okay.
somewhere in our gene, yeah. So
Okay.
it's commoner with us. And then there's something called gestational diabetes. That's you had a pregnant woman who had diabetes only during pregnancy. Um, if someone has had that condition, so you had very high glucose level, but then about 6 weeks or 2 weeks, 3 weeks, before 6 weeks after delivery, it goes away. After delivery, you don't have the diabetes again. That's called gestational diabetes. It only occurs during
During
pregnancy.
pregnancy.
That person is
Okay.
at more or at increased risk of having diabetes within 10 years after the last delivery.
Wow.
So that's another
Risk factor.
non-modifiable risk factor, as it were. But then, what we should really major on
No,
or
I was gonna
focus on?
ask you. I was gonna ask you how about diets? Because we're told that when you take too many sugary things, it can
How
cause
about what
diabetes. Diets. Diets. We're told that when you.
does now? Diet will fall under the modifiable risk factors. That is things that you can adjust, either reduce or increase to reduce the risks that you're going to have diabetes. For example, family history, there's really nothing you can do about it. Uh, your race, there's nothing you can do about it. So those are non-modifiable risk factors. But we'll be going on now to the modifiable risk factors, things that can be adjusted to reduce the chances of having
So
diabetes.
let me ask you now. Talking about family history, where does it stop? Is it with your grandparents? Because you can't trace your great grandparents to know if they had
Yeah, I
diabetes.
didn't hear you. Where does it fall?
What I'm saying is, at what point is it traceable? Because you can't trace beyond your grandparents to know who had diabetes. You can't trace your great grandparents. Yeah. So where
We are
does it?
most concerned with a first degree relative. First degree relative means just the generation before you. So your father,
Okay.
your mother, as well as your siblings, then your uncle. So that first degree. Yeah.
Okay, that's the
We are
focus.
most concerned with that first,
First degree.
with those around you, and at least you can trace your siblings, even of them as most times your father or mother, you may be able to trace and those ones. Then your uncle,
Your uncle.
yeah, or auntie, yeah.
Okay.
I'm most concerned with that first degree
Okay.
relative.
So when you talk about diet, does it include staying away from sugary drinks and food? Because we hear that a lot, that when you take too much sugar, you're at risk of coming down with diabetes.
Yeah, that can happen usually in the background of other things. So it's usually in the with the background of things like obesity, um, things like family history of diabetes, things like smoking, or even hypertension. When those backgrounds are there, taking a lot of these sugary substances for a very long time, especially when you continue at a very high degree after 40 years of age, you are more prone to diabetes. But you also notice that there are persons who take a lot of things and they don't come down with diabetes. So
Yeah.
diet is not an absolute cause of diabetes. I don't know if you understand. It's only
Yeah.
diet is not likely to cause diabetes. But it can occur on the background of certain other problems like family history, like I mentioned, obesity. Obesity is one of the major risk factor, a major um, modifiable risk factor for diabetes.
Mm.
And if instead of measuring on diet, rather than in population measure on diabetes, in fact, a lot of times the way diet causes or makes a person prone to diabetes is by causing obesity. So
Mm.
it's that's increasing weight. That's what we mean by obesity. Um,
Okay.
weight change,
Weight
um,
change.
being on the big side
Okay.
compared to your height. Usually, we check your weight and
And
then
your height.
also check your height because at every height there is a range of weight you are supposed to attain or you're supposed to have for your height. So if
Mm.
you are above that weight, you are getting to a point of overweight. And then if you go beyond overweight, you are getting to obesity. And obesity is a very strong risk factor for diabetes. What it does is it
All
makes the
right, doctor.
body.
Let's hear from this caller to ask.
Okay,
I haven't called out the number, but hello. Good morning.
that's fine.
Hello. Good morning. Good morning. Okay. Please try to call back 0805 We're looking at diabetes. It's World Diabetes Day, and it's important that we take care of our health. Health is wealth. So, even if you're not currently managing diabetes, it's important that we create awareness about the disease and be a part of it. Create the awareness wherever you are. All right, 0805 or 0705 890 4927. If the network is not steady this morning, you can send a WhatsApp message to 0705 6900927. That's if you have questions about diabetes and just preventive measures and whatnot. All right. So, doctor, I was asking that why I asked about diets is because growing up we had things like when you take too much sugar, you have diabetes. So, if that's not a direct cause or risk factor, just to deviate a bit, what does too much sugar intake then cause? Just hold that thought, please. Let me take this call. Hello, good morning. Hello, good morning. Oh, clearly the network. Hello, good morning. All right, apologies for that. I can't even access WhatsApp right now, but you can try. Keep trying. Let's keep trying. Okay, doctor. Now, what is the risks involved with taking too much sugar? Just to deviate a bit, because that's always associated, too much sugar intake and diabetes. That's what some of us were told growing up.
Yeah, so I was saying, I think I already answered to an extent. So I said, um, I did not exactly say too much
Let's try to take the
sugar
call
intake
again.
does not cause diabetes. Can you hear me?
Hello, good morning. Hold that
Okay.
thought, doctor. Hello, good morning.
Good morning.
Good morning. Please turn down the volume of your radio. Thank
Okay, I've
you.
done that already.
All right, what's your name?
This Ken from
Ken,
Texas.
Ken from First Stack. All right, good to have you on Spotlight. So, what's your question or contribution?
Okay. I've been listening to the discussion and I'm kind of particularly concerned because I have a family history. My mom had diabetes and I'm way past 40. So I want to know, are there some outward signs that someone will be feeling in his body that will make the person to feel like, okay, let me go and take my sugar level? Are there some outward signs that diabetes normally display at the onset?
Okay, yes. We're going to get to the symptoms. He'll talk about it shortly. So, just stay with us.
Or,
Thank you.
okay, thank you.
Okay, so he was already asking about the symptoms. So I said we're going to get to that. We're looking at the risk factors shortly. So you were talking about sugar.
Yes. So I said that what diet does, because it's a misconception that sugar causes diabetes. We don't. It's not seen as a cause. It's seen as a risk factor on the background of several other risk factors. And the way it's a risk factor for diabetes is by causing obesity. So because you are taking to answer your question directly, the main outcome of taking too much sugar is it's converted to fat. Excess sugar is converted to fat, then stays in the body and then causes obesity. So you see children who at 2, 3 years they are already very big because the parent thinks they should keep feeding, 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 feeding. What's happening in that child is sugar is being converted to fat. The same thing is going to happen in an adult who takes a lot of sugary substances, especially on the background of sedentary lifestyle, that's inactivity. You come to work in your Jeep or in your car with AC, you are sat from 8 o'clock to 4 p.m. You really don't get to work or stand to do anything, except the time you want to go and eat, and then you come back, you sit down again. That's what we usually call a sedentary lifestyle. So the combination of this poor dietary pattern and a sedentary lifestyle that is inactivity, physical inactivity,
Yeah.
no exercising and the likes,
All
will
right.
culminate into causing obesity, and obesity is the risk factor.
The risk factor.
for-
Okay, so one more thing before we start to talk about the symptoms. What's the correlation between diabetes and high blood pressure? Because I've seen a lot of people that have diabetes, they also have the high blood pressure, or people that have high blood pressure. So what's the connection?
Okay, both of them are chronic diseases. Chronic disease means that, and I was going to talk about it maybe later, or I'll get to the treatment. It's chronic disease means they are diseases that are managed for very long, but even worse in this case, they are managed for life. There is no cure to either of diabetes or hypertension. But generally, hypertension can be a risk factor. That is, someone that already has hypertension may begin to develop diabetes because both of them sometimes have the same underlying risk factors. So, for example, I talked about obesity. Obesity is both a risk factor for diabetes and hypertension. So if the hypertension is being influenced by obesity, then you can as well think that this person may have diabetes because of the underlying obesity. I don't know if you understand.
Yeah.
It's not as if one causes the other, but they can have the same underlying risk factor, such that you see a lot of persons who have diabetes also have hypertension because the risk factors were basically the same.
The same. Okay. Now let's talk about the symptoms. And please, doctor, you just help us break it down. Are there early symptoms? Are there advanced symptoms? Because the caller now asks that he's above 40 and his mom had diabetes. So he wants to know about the early symptoms. If it's, some things that he should look out for.
Okay. Yes, there are early symptoms of diabetes, and late symptoms I will classify as complications, things that diabetes will lead to um, generally. So but before then, I think the first thing to mention is that in more than 80% of the cases, there are no symptoms initially.
Wow.
Yeah, most times there are no symptoms for years. The person has diabetes, but then there are no obvious symptoms of diabetes. It's not like something that's going to cause you headache or cause you stomach pain or you begin to have backache or leg pain. No, diabetes does not cause any of those. So usually it goes undetected for years. And so we usually advise if there are underlying risk factors, for example, what you just mentioned, a family history, like the mother or father or
Yeah.
sibling or any first degree relative with diabetes, will counsel that at least when you are above 40, you should check your glucose level at least once in a year. Just go for a routine
And
glucose
check.
checkup.
Okay, but
It's,
Dr.
it's very
Samuel,
fast.
Dr.
Yeah.
Samuel, recently someone around me was urinating and then ants were gathering the urine. Is that part of an early symptom or that's already when there's a complication?
Yes, that's the symptom. I'm coming to the direct symptoms now. I needed to explain first before we come to the symptoms that um, the fact that someone does not have these symptoms that I'm going to mention now does
Mm.
not mean he cannot have diabetes. So the best thing to do is to have a routine check if you have, especially rather if you have risk factors and if you are above 40. So I'll
Okay.
come to the direct symptoms now. Like you mentioned, there are symptoms that are urinary, that is things that have to do with urination. They are one of the early symptoms for those that are going to have symptoms. And that will include what you just mentioned. There's a lot of sugar in the urine. So um, nowadays, we don't really urinate on the floor anyways, but if that happens,
Mhm.
you may see ants gathering on the urine. But more objectively, is the person they begin to have a lot of urination, that is, urinating a lot of times in the day. Yeah, it's one
Okay.
of the uh, very obvious symptoms of diabetes. The
Okay.
glucose level, high glucose level, will make the person urinate. Usually,
Often.
maybe you're supposed to urinate like 3 times in the day, maybe once at night. But then you see this person urinating up to 6, 7 times in the day, and then maybe up to 4 times at night, waking up every time to urinate. That kind of person likely or is someone that may have uh, diabetes. They should go for a checkup. And other symptoms that are urinary is recurrent uh, urinary tract infection,
Okay.
recurrent
That's for
UTI,
women.
always splitting.
Is
Can
it
you hear
for
me?
women or men?
What do you say?
I
For
said
both women and men.
okay.
But urinary tract infection is common now with women. So,
Okay.
but it can happen with both women and men. Recurrent urinary tract infection.
Mm.
It's basically easy to understand. There is sugar in the urine,
Mhm.
microorganisms, bacteria, and the likes. They like sugar, so they tend to colonize or stay a lot in the urine and then ascend through the urinary tract to cause infection. And other symptoms will include eating a lot.
Hmm.
Yeah, people that have diabetes tend to always get hungry if the diabetes is not being managed. And like I said, reasons are that the body feels there's a lot of glucose in the blood, but the body is not getting it into the organs. So the kidney is not getting, the liver is not getting, those organs that need the glucose, they are not getting it. So what's going to happen is the brain thinks there is no glucose. That's how the brain is going to interpret the fact that these organs are not getting the glucose. So it wants the person to eat much more. So diabetes is what we sometimes call suffering in the midst of plenty. There's a lot of glucose, the
Lots of
body is not
food.
using it. The body
Yeah.
thinks there is no glucose, and so it begins to cause this person to eat a lot, and that can now lead to more weight gain. Weight gain, we said, was a disposition or was a risk factor for diabetes, but then diabetes can also, uncontrolled diabetes can also lead to weight gain because this person is going to be um, eating a lot.
Okay.
Now, because he's also urinating a lot, he's also going to be very thirsty quite frequently, and so wants to take a lot of water as well. So increased thirst is also may also be an early risk factor early sign rather of diabetes.
Okay. Now, we'll move on to the treatment part of it or prevention. Should we talk about prevention first or the treatment? Which one is more? Which one do you advise more? What is the major challenge you face in your practice as regards treating diabetes?
So I didn't get that clearly.
Okay, so
You asked
I said we
prevention.
should talk about prevention. You mentioned that the one with genetics. You said okay, there isn't much beyond just going for the checkup. Are there meals? Are there certain diets that someone should stay away from when you know that you are at a higher risk of getting it, given that your mother or father or somebody in your family had it?
Yes. Um, so on the background of certain risk factors, like you just mentioned, for diabetes, before the disease happens, there are things that can be done to prevent diabetes. That's preventive measures, and that will include watching the diet, so reducing sugary substances, uh, also food substances with a lot of sugar content. For example, rice. Where in Nigeria we eat a lot of rice every
Rice.
time. Yes, and you can eat rice if you don't have diabetes, but not that your run to or go to food is rice every time. It's not so healthy after 40 years of age. There are some rice like basmati rice that are very okay, but like we will understand they are more
Okay,
expensive.
yeah. So
Yeah.
I was going to say, doctor, let's break it down. What if I can't afford rice every time and I want to prevent diabetes? What would be some options? Like for
If
swallow
I can't
now, are
afford
there,
what?
if you can afford rice
Yeah.
every time, but then you don't want to come down with diabetes because you know that somebody in your family already has it. So are there swallow options like you want to eat instead of gari or fufu, which one would be, are there advisable options to
That
take?
alternative foods
Yes, alternative
instead of
foods.
this,
Yeah.
right? So food substances like plantain,
Okay.
very good. Even yam is carbohydrate, but it's very okay in diabetes. I'm sorry, to prevent diabetes as it's
Okay.
then when it comes to swallow, food substance like wheat has very minimal level of
Sugar.
um, glucose. Now, we're not saying you totally abstain from all the other foods like the ones I was mentioning earlier, but we're saying that you augment or you increase the level of these other until you have diabetes, and you reduce these other ones and increase. So those food substances like vegetables, a lot of vegetables, um, and then fruits
Okay.
that are low in what's it called in glucose. So fruits that are low in glucose will include things like um, I
Orange.
already mentioned
Which
things
one?
like orange, for example. Banana, for example, has a lot of glucose, especially ripe banana. So you may want to reduce the level of banana intake. And then pineapple too has a lot of glucose. So you also want to reduce that. But then orange and its family, they are very okay for um, for diabetics.
Okay. Thank you, doctor. So, if you're listening, this is World Diabetes Day, and we're looking at that on Spotlight this morning. So, if you have
Right.
questions and contribution, you can call the studio line on 0805 092 0927. That's 0805 092 0927. Or you can call 0705 890 4927. That's 0705 890 4927 to ask your questions as regards diabetes. Okay, so now I forgot to act. I'll need to take you back a bit, Dr. Samuel. The diagnosis. How is diabetes diagnosed?
Okay.
Yeah.
So the diagnosis of diabetes is hospital based. I mean, it's done in the hospital. Let me start from that. Sometimes during outreaches and outpatient visits, we can diagnose diabetes, but usually it's hospital based. What we do is to check the glucose level. So we'll start with the random glucose level. So you come to the hospital, say
Okay.
by 12 o'clock, 8 o'clock, 10
Yeah.
o'clock, wherever time you come, you have eaten that day. We want to check your random blood glucose. Random means it's checked at any time. It can be checked at any time, basically.
Okay.
But it gives us an hint to go further with the other testing. So, but the main test or a major test we want to do further from here is the fasting blood glucose level. So, the fasting blood glucose level is the first major test we want to do, especially after a random may have been done. So a fasting blood glucose level will mean that we'll tell you not to eat the previous night from
Mm.
about 8 or 9 p.m. till the next morning when you come to the clinic.
Mm.
Anytime from 8 o'clock, 7 o'clock, 8 o'clock, 9 o'clock, but before 10 o'clock, we would have checked your glucose level. Anything after 10 o'clock, we don't consider it fasting blood glucose anymore. So you
Okay.
don't eat from a previous night at
Mm.
about 8 to 9 p.m. till the next morning. So that's like a 12 hours kind of fast. So
Yeah.
somewhere around 8 or 9 in the morning,
In the
we check
morning.
the glucose level. If it is higher than the expected range
Mm-hmm.
that we want to see, we know that this person has diabetes. Then we go further with our test to check the HbA1c. HbA1c is to see how the glucose level has been high for the last 3 months. We're
Okay.
checking the hemoglobin. Sorry, red blood cells survive for 3 months. So if the glucose level in the hemoglobin is high, we know that this thing has been occurring for at least 3 months, likely more than 3 months. Yeah,
Okay.
it has been high
Let's
for
take
that long.
this call, doctor. Okay. All right. Please try to call back. Obviously, the calls are not getting through. Okay. Let's take this one. Hello. Good morning.
Good morning.
Hi. Good morning.
I'm very good, thank you. My name is Charity, Mrs.
Okay. Can you please turn down the volume of your radio? Thank you.
Okay.
Yeah. All right. What's your contribution?
There is no
It's
contribution.
a
I'm
question.
a patient to this
Okay.
issue.
Okay. Please go on.
So last week, I think I had a nutritionist telling me that I should cut off eating wheat. That is gari or fufu with a lot of vegetables. That is good for me. So I want to ask doctor if to eat because I've been dealing with wheat from 2018 till date. I've not had issues. I'm on that treatment. I'm taking my metformin. Okay.
Okay. So
So
what's the question?
I want to ask doctor if that is okay to stop eating wheat and go for gari or fufu with a
Okay.
lot of vegetables.
Okay. All
Thank
right.
you.
Thank you. All right, Dr. Samuel, did you get the question?
No, I could not hear anything
Okay, so she said that she was advised to stop Gary and just eat wheat. She has been taking, the wheat and vegetables, But now she's asking that is it okay for her to just stop taking the wheat and go back to eating gari and
Is it okay for her
lots
to
of
do what?
vegetables, to take gari and eat lots of vegetables.
Or you take gari and eat lots of vegetables? Is that what you said?
Yes, because she's currently taking lots of wheat. She said she was advised to get off according to the diets now. We're talking about diets. So she's asking that can she take the gari, can she go back to that diet and, alongside lots of vegetables?
Okay. Sorry, did she mention if she's diabetic already or this prevention?
Yeah, I think she's diabetes. Okay, Charity, if you can call back to give clarity on that. But the way she asked the question, I think she's already diagnosed and, she's managing
Oh,
it.
okay.
Yeah, that she takes her medication, but she wants to know if she can go back to eating Gary.
Okay, so for those that have been diagnosed with diabetes, um, there is, as part of hospital protocol, usually you will see you'll see a dietitian. A dietitian is someone who is an expert in diet, so that he, based on your glucose control, usually a
Nutrition.
how do I put this now?
Yeah.
A weekly, let me put it that way, a weekly maximum level of the different food substances will be given to you. So like I said, we've gone past that era of saying you're diabetic, don't take this food at all. That's not what we do anymore in standard hospital care.
Okay.
What we do is, with the help of the dietitian, measuring calories in different food substances, they're able to tell you this is as much of this as you can take.
You can take.
Specific
Okay.
to different patients.
All right. Let's
So
hear
for
from
this
this
patient, may
caller.
be different for these
Hello.
other
Good morning.
patients.
Hello, good morning.
Good morning to you.
This is Ukego.
Uchego.
I'm calling from Egbeda. Ukego, Eukarya.
Okay, Eukarya from Egbeda. Good to have you join us. How's
Yes.
Egbeda this morning?
Very fine, thank you.
All right. So what's your question?
Okay, so I don't have a question. I actually have a contribution. For like the wheat, I took wheat for years, and I started having itching eyes. So I later found out that it has high level of gluten. And a lot of people that took it around me had the same complaint. So I switched to oats. So I blended oats with plantain and millet. That's guinea corn, sorry.
Okay, did your
And that
nutritionist advise you to do that, or you did it by
Yes.
yourself? Okay.
They did for my mom. So we all started just taking it, and it's been reducing. It's been helping with weight gain. It's been helping health-wise. It's really light, and it's been so good, more than any other thing that we have done so far.
Oh, okay. That's nice.
So I think for some people, they react to the wheat.
Mm.
So I had serious allergy to the wheat.
Okay.
But for some others, they didn't even notice.
Okay. So you said you
So-
started taking wheat and plantain.
No,
And
oats, Quaker oats.
okay,
So you
wheat
can
and
go
oats.
to the market, you can buy like a pint of oats, then 1 derica of that red corn and plantain.
Mm.
So
All
you
right.
blend it all together. You have one of the most delicious and healthy swallows.
That's unripe plantain, right? Not the ripe plantain.
Yes, unripe plantain. No, unripe plantain. So you
All
buy
right.
the dry,
So-
the one that is dried already.
So you're diabetic.
I am not. I'm on the big side, so I'm just trying to keep it
Okay,
away.
to keep it away. All right, that's a good one.
Yeah.
Thank you so much. Thank you.
Thank you. All right.
All right. So, as long as we're not calling out drugs, and she confirmed that her nutritionist advised her. So, Dr. Samuel, you are saying that you have to work closely with the nutritionist and dietitian to guide you properly on the diet as regards diabetes, right?
Yes, yeah. But one of the major challenges we face is adherence to dietary advice. So it's quite difficult to say these food substances you've been seeing since you're a child,
Mm.
and diagnosis of diabetes at 50 something, and then we say totally stop it. It's quite difficult.
Yeah.
So what we do now is, and then it's producing the same effect, the
Okay.
same result rather, as totally
Yeah.
stopping it, is to work closely with the dietitian to give a maximum weekly allowance of
Okay.
different food substances.
On that. Okay. Now, we have to put the costs in mind as well, because that might just
Yes,
be the issue for some. But about diagnosis, you're saying that the ones you mentioned are the only verified way to diagnose
so
diabetes.
can you
Because
come
I'm
again?
asking,
I didn't hear you clearly.
okay, so about diagnosis still, you know that in some parts of the country, there are people that go out with machines, like there are some equipments they go out with, and then they make announcements that they can diagnose any sickness in your body just by tying the wire to your hand. The computer can tell you anything if there is diabetes and things like that. So apart from the blood sugar check you talked about, that's the only verified way to check for diabetes. And you would discredit those roadside tests for diabetes, right?
Yes, unless they are medical personnel who have the we don't just put something in your body and then it shows that, oh, you have diabetes. No, would eventually still have to check your blood. Sometimes, a very few times, but it's not diagnostic. We can check your urine, but it's usually when diabetes has progressed that we'll see glucose in the urine. Yes, but it's still not diagnostic. There are different causes of glucose in the urine. So diabetes is not the only cause of glucose in the urine. So even if we check your urine, we'll still have to check the blood to be sure that it's diabetes that is causing the glucose in the urine. So by putting something in your body to just
To
check,
just
the only
check
thing we really do that way, or the major thing we really do that way,
BP.
is hypertension, and
Yeah.
that's to check the blood pressure of the person.
All
Yeah,
right.
but
So
not those roadside. Yeah.
okay, all right then. Thank you for that, Dr. Samuel Omobade. We're running out of time, so let's just get on with. You talked about also now quickly, Dr. Samuel, for the type 1 diabetes. You talked about autoimmune, the body fighting itself, and it's common in children. So how can how can a woman now prevent this from happening? What are some preventive measures so that your child does not come down with diabetes?
If I got your question right, how can a pregnant woman prevent
Yeah,
um, type 1
diabetes.
diabetes from occurring in her child?
Yes, yes. Is it possible?
It's not. It happens sporadically. It's not something that has a particular at least um, as much as I know, is to check for, there are some markers, there are genetic markers, but then they are very expensive again. Genetic markers to show if your child is likely to have type 1 diabetes. And that's what we usually call HLA, DQ4, and the rest. It's just to check for those. So, but really, there is sporadic in occurrence. So there's really no prevention as it were. And
Okay, yeah,
gratefully, I mean,
yeah.
God helping, there are very few,
Very few.
or
All
they are
right.
quite few. Yeah.
Okay. Now let's talk about the treatment for diabetes. What are the treatment options?
Okay, treatment options. So usually treatment option is to, first of all, if there's something called pre-diabetes. So if we are noticing, or if we are seeing a patient at this point where he does not have full-blown diabetes yet, it's just pre-diabetic, we usually start with the dietary option. So to reduce, so what I was talking about,
Yeah.
work with dietitians to reduce the amount of calorie from different food substances the person takes. And that's usually enough at that stage. Some persons can be at pre-diabetic stage for years without developing diabetes. So they are just being managed on their diet. But usually, most times we catch our patients, or we see our patients at the level where they're already diabetic. So we want to start with oral medications, so oral hypoglycemic agents. So those are substances or drugs, medications
Mm.
that reduces the glucose level in the body from
Yeah.
that very high level to a normal range. So there are a lot of anti-diabetic
Mm.
um, in the hospital
Okay.
setting.
Yeah. So the
Usual
doctors
naturally the
prescribe
most
that.
appropriate for particular patient.
So
But yes,
what are your thoughts
that's what we
on
do.
self-medicating now when there is no money to buy the treatment? Because I hear
It's
that the drugs are expensive.
You mean self-medication? Is that what you said?
Yes,
My
I hear
thoughts on self-medication.
self-medication. What's your advice on self-medicating when one has diabetes?
It's very, especially for diabetes, it's very harmful. It's a no-no. Reasons being that for diabetic, for someone that's already diagnosed with diabetes, we are very much concerned with a complication of treatment. One of the major complications of treating diabetes is hypoglycemia. So usually hyperglycemia means too much glucose. That's what you see in diabetic. If you are taking your drug at a higher than normal rate, which you cannot know on your own, except you're in the hospital setting, um, what it tilts to is the drug begins to reduce your glucose level and crashes it to a very low level. And people are going to coma from that, from taking two overdose, as it were. They didn't know, but then they were taking overdose of their medication. So self-medication is a
It's
no-no.
harmful. Yeah.
Yeah, so I'm very concerned with hypoglycemia. Hypoglycemia is
So
considered
what
worse
is what?
than hyperglycemia because very easily it tilts the patient into unconsciousness.
Okay. So what are some complications associated with diabetes? I know that growing up, you see some.
Come again, sorry.
I'm talking about the complications associated with diabetes when it's not properly managed. I've seen cases of open wound that doesn't heal. Is that like the last stage of it? Let's see if we can squeeze this call.
All right.
Hello, good morning.
How are you doing?
Fine, thank you for asking. What's your name and where are you calling from? Oh. All right, please try to call back, although there's no time anymore. So I was asking for complication. What are the risks involved when you don't properly manage the condition?
Okay. So the complications of diabetes are quite a lot, but I will stay on the very major ones, more common ones that we get to see. So they usually occur. Complications usually occur in the setting of not treating or not taking medications appropriately, and so they usually include things like eye defects, like cataracts, or not being able to see clearly, blurry vision. As simple as that can result from diabetes. Diabetics can sometimes have kidney problems.
Okay.
Yes, from the diabetes. There's something we call neuropathy. Neuropathy means, in layman terms, peripheral neuropathy is one of the types of neuropathy. It means that the distal, that is the extreme part of the body, like the legs, the limbs, are unable to feel sensation. So you touch, you pinch this person, you put a pin in this person's leg, he's unable to feel it. He just sees that, oh, you put a pin, that's how he knows. So usually such patients are now prone to injuring themselves without knowing. So that's what you were talking about. So sometimes they may sometimes eat something and they don't feel as much sensation as the average person is going to feel. And so because of that, there are injuries. And injuries in diabetics are difficult to heal up, still because of too much glucose in the bloodstream. So that injury can begin to progress, infection sets into the injury.
Yeah.
And then gangrene, that is that part of there's no more useful.
No more. All
and
right.
because there's infection there that cannot be cured or treated easily, it can progress to
all right. Dr. Samuel, this has been really insightful. We're on the clock. Well, thank you so much. I've learned so much about diabetes, and I believe that we've created a lot of awareness about this already this morning. Thank you. We'll have the conversation. I'm Jones, I was going to ask you, but what would be your parting words? What would be your final words on the program as regards diabetes?
All right. Thank you very much.
Your final words.
I heard you. Okay. So first, I would like to say that as much as we've said so many things about diabetes in the time that we had, it's something to be totally afraid of. That is the person to a point where people live their full age as
Yeah.
though they never had it. Yeah,
Yeah.
with medication. So,
Thank you.
and I would say that it's not something to be scared of.
All
Go
right.
through
Just
the
take care of your health.
diagnostic
Thank you, doctor.
procedures, and
I'm kicked out.